May I come in?
Hi, yeah, sure.
Hi, Claire. My name's Nina. I'm the nurse here who has been assigned to talk to you about your discharge. How are you feeling?
I'm feeling a lot better.
Yeah? That's awesome. It's really good to see it.
Yeah.
Yeah.
I'm sort of reading some pamphlets that I've got.
Okay.
Yeah.
Good. So obviously those are for you to take home.
Okay.
And I'm also here to answer any questions you might have before you go. So we're just going to kind of go over things that you need to know going forward, and then, any uncertainties you might have, because I'm sure it's a lot to take in.
Yeah.
Yeah.
I have a few questions. Yeah.
Totally. So you're just diagnosed with ulcerative colitis. How are you feeling about that?
I'm feeling okay, like a little unsure about a few things.
Mm-hmm.
Yeah.
Okay. Anything like right off the top of your head that you
Yeah.
want answered, or?
I think the first thing, I don't really know what my medications are doing.
Okay.
What they are exactly.
Yeah.
Yeah.
Yeah, for sure. They can get confusing.
Mhm.
I'll try and break it down a little bit. The physician has prescribed you 2 medications. The first one is something called Balsalazide. It's something that you're going to be taking every day. And basically what it does is it reduces the inflammation in your colon. And that inflammation is what's causing those sore spots in your colon, the ulcers. That's what's causing that pain and all the other symptoms you were having.
Okay.
So by reducing that swelling, it's going to reduce the chance of you getting any more ulcers.
Mhm.
And it should also decrease the chance of you getting any of the diarrhea or blood in your stool or anything like that.
Okay.
So that's something, you take it every day, 3 times a day. So that's why people usually find it easier to take with meals, just kind of because it prompts them to remember taking
Right.
it
That's
at
a
3
good
times a
idea.
day. Yeah. And then the second one that he's prescribed is something, it's a corticosteroid. So that's something that you use more for like short-term flare-ups. So if you're feeling like really gross one day or really not good, that's kind of when you would take something like that, or if you feel it kind of coming on. And you wouldn't take it for a long term, and that's also like the time where if you're feeling unsure, you can always come back in and ask. But it's just something to help hold off on those really short-term bad effects that the colitis does cause.
Uh-huh.
With that one, you have to make sure it does cause more side effects, so that's why it's generally used in the short term.
Okay.
Just less side effects than your daily one will cause. So just make sure you're not taking it for a long time. If you feel like you're taking it too long, that's when maybe you should come back in.
Okay.
Yeah.
Yeah.
Does that make sense?
Yeah, thank you.
Okay. Very good.
Yeah, so what are those side effects exactly?
As I said, the Balsalazide, kind of minor side effects, you might get a little bit of nausea, vomiting, headache, anything like that. Generally, people find them very tolerable. That's why they're kind of every day. The corticosteroids might cause some harsher effects, just like immunosuppression, so making your immune system go down a little bit. Might also cause some like loss of bone density, taking in the long term. So if you do find yourself taking them for longer than a week and not getting rid of those flare-ups, that would be a time to come back in. Yeah, for sure. That makes sense.
Thank
Okay.
you.
Good. I was also just wondering if you'd be interested in talking about any kind of like alternative treatment options. Some people are interested in things that might help that are other than medication.
Yeah, I would really like to hear about that.
Okay, cool. I did do a little bit of research on it and found that some people, have you ever heard of like turmeric before?
No, I don't think so.
No? Okay. So basically it's a spice that it's often used in a lot of kind of Asian food. It's not super spicy, it's just found a lot in that kind of food. There's evidence that suggests that it reduces inflammation in the gut,
Okay.
and that prevents those flare-ups. It doesn't really cause any side effects. Just the main thing to remember with that would be trying to take it with pepper, actually, because those two taken together, the pepper makes it so the turmeric is more readily absorbed, so
Cool.
works
Okay.
better. Yeah. And it's something you can find pretty much at any grocery store and just add it to any curries or even like on some rice or anything like that.
Awesome.
Yeah.
Okay. Thanks.
Cool. Yeah, it's good to know those kind of things.
Yeah. So do I need to change my diet other than that?
That's actually a really good question. Because it is so intertwined, it's important to know the foods that you should avoid and the ones that you should be eating.
Mm-hmm.
So it kind of is different for each person. Trial and error for sure. You got to find what makes it worse and what makes it better for you.
Yeah.
As a general rule, people find it helpful to keep kind of like a food diary. So that's like something you just either have on you on your phone or a little notepad that when you have a food that you eat that causes a bad reaction, you write it down. When you have a food that you eat that doesn't bother you, you write it down. Just so it's something like on you could refer back to.
Yeah.
Just if you're ever going out to a restaurant or anything like that.
Okay.
Yeah.
Cool.
But those foods that do tend to cause more flare-ups are things like dried beans and fruit, foods that are really high in fiber, so like any high fiber cereals, any kind of like whole wheat bread or whole wheat pastas. Nuts can sometimes cause it, popcorn, raw fruits and vegetables sometimes as well, seeds, and sometimes spicy foods people find are really hard to tolerate.
Okay.
Yeah. Here's a pamphlet, actually, that has all that information on it, just because I know it's a lot to take in.
Yeah.
Yeah.
Okay.
You'll also see on there, it talks about foods that are well tolerated, and those are foods more like white pastas, white rice,
Okay.
cooked fruits and vegetables, and like soft meats and fish, also generally very well tolerated.
Okay.
Mhm.
Awesome. Thank you.
Yeah.
What about drinking?
Drinking, yeah. So as far as drinks go, it is recommended that you limit the alcohol intake, as well as caffeinated drinks and carbonated drinks. If you don't mind my asking, what is your normal alcohol consumption?
I don't really drink that much.
No.
Like maybe one or two on the weekend.
Okay, yeah. Again, trial and error. You'll find out what your body can handle, but I think that sounds like an appropriate amount for what you've got going on. Yeah.
Okay.
And what about, do you smoke?
Yeah.
Yeah.
I do. I've been wanting to quit. So this might sort of be the push to do that.
Yeah. I know you've had a lot going on, so it's hard to just quit something like that so quickly. But smoking is generally something that will cause more flare-ups.
Yeah.
It's something like I know stress and cigarettes can be intertwined.
Yeah.
Yeah.
And I mean, I do notice it gets worse, but it's been hard to quit. And
For
I'm gonna
sure.
try.
Yeah, exactly. That's all you can do at the beginning, and I think like we can really refer you to some good resources for quitting if you're interested in something like that.
Yeah.
That other patients have found effective.
Awesome.
I'm just wondering, as far as support systems go, what does that look like for you?
Well, my dad just died.
Mhm.
I don't feel like I have a lot right now.
Okay. Yeah. I mean, huge life changes happening for you right now. I am really, really sorry to hear about your dad. If you are interested, I can refer you to some great local therapists that I've heard very good things about, and they are just always beneficial to have someone to talk to, just to help reduce stress levels, and again, that might contribute to reducing the smoking as well.
Yeah. I really appreciate that.
Yeah, I think people have found it effective. Same with support groups. If you can talk to people who are going through the same thing or who have the same condition, just to hear it firsthand what it's like. Yeah, you interested in that?
Yeah, I'd really appreciate that.
Okay, great. I will get those referrals for you.
Thanks.
Do you have any other questions at the moment?
I guess just I'm curious if I can still exercise.
Yeah.
Like how much is okay, I guess.
For sure. That's a really good question. Exercise is good all around for ulcerative colitis. It's always good to keep moving. Generally for this condition, it's best if it's moderate intensity, so something like biking, swimming, that you can do like a couple times a week that you can feel like you can manage. Running is tend to be more intense, so again, you can work up to it, but just to start off moderate intensity, so biking, swimming,
Okay.
stuff like that. Have you ever done any sort of yoga or anything like that?
Like a little bit. I think I'd like to get more into it though.
Yeah, that's
Yeah.
awesome. That's also been found really good to help with ulcerative colitis.
Okay.
Yeah, it keeps the blood moving, keeps oxygen going all over the body, and that it can help heal any little ulcers or anything you have going on.
Cool.
Yeah.
Yeah.
So yeah, same thing as I said, but just trying what works best for you.
Yeah.
Yeah, I think I've covered everything I need to cover on our discharge teaching. Do you have any other questions?
I think that's everything.
Yeah?
Thank
Okay,
you.
awesome. Yeah, thank you.